And there it is. So again, welcome. I'm Rachel Bonsignore, the director of Liftoff of Western New York, and welcome to all of you who are joining us for the first of our three-part summer learning series, where this conversation we are focused on early childhood oral health and have a state leader and expert that's going to be sharing some wisdom and showcasing a recent report, and I'll be able to introduce her in just a moment. For those of you who are newer to Liftoff, we are an aligned action and learning network of the 8 counties of Western New York that are really trying to drive and coalesce around some early childhood priorities that include access to high quality, available, affordable childcare. We want to make sure that children are receiving developmental screenings and connections to services and supports in a timely way. And we also have a focus on transportation, ensuring that children and their families have access to care and services where they live, knowing it is such a difficult challenge for many throughout the region. And as I mentioned, we are a learning network, so periodically throughout the year, we have lunch and learns, in-person events where we're really trying to uplift and highlight key issues and priorities for for young children in the region. And this is a really exciting day for us because we're talking about a topic that has increasingly come up in many of the conversation in early childhood coalitions that Liftoff is a member, in statewide policy conversations, and just hearing from parents and caregivers and providers how much this is really impacting the health and well-being of young children in their care. So it is with that I would love to introduce our featured speaker today, our friend and partner, Bridget Walsh, joining us from Albany today. For those of you who haven't had the opportunity to be introduced to Bridget or work with Bridget, I cannot think of anyone better to help lead this conversation and provide insights for us today. Bridget is the Senior Policy Analyst for Health and Public Health at the Schuyler Center for Analysis and Advocacy. In this role, Bridget is really leading the charge for policy analysis and advocacy for the Schuyler Center in the areas of early childhood health, oral health, maternal and child health, nutrition, and healthcare access. She is, as I mentioned, an aficionado and is joining us today to share more with all of you. I'll ask that if you could hold questions throughout Bridget's conversation and presentation, and we'll definitely make sure we have time at the end we really want to make sure that this is interactive. You can share comments. We will definitely have the opportunity to learn from one another and make sure we're hearing from each other throughout the region and throughout the state. So with that, Bridget, I'll ask you to come off mute and we'll get started. So thank you so much, everyone. And thank you, Bridget, again.
Thanks, Rachel. And it's a pleasure to come today. I was excited when Rachel asked me because, as all my colleagues here know, if I get a chance to talk about oral health, I will do that. And so this gives me an outlet to talk about teeth, which I often do here. Just for those of you who don't know the Schuyler Center, we are a statewide human services advocacy organization that works for policies to improve health and human services for all New Yorkers. But our focus is really on children and families living in poverty, and we're working to end childhood poverty as some of our work. We've been around for 150 years, so we've been doing this for a long time. And oral health has worked into our early childhood work and our childhood work because we're particularly interested in that intersection of poor oral health and poverty. I want to start by letting everybody know, as I do every time I talk, is I'm not a dental professional. I have never looked in anybody's mouth. I know nothing besides policy side of this, no clinical side. I don't do that. There's other people that speak very eloquently who are providers, but my focus is really on the policy side. So I start with that caveat all the time. What I'd like to do today is give you a little bit of background on early childhood oral health and some statistics, some data, and then talk about some of the work that's going on at the state level and how you can participate in that work. And then I really want to leave time to sort of hear what you're thinking and what you're seeing in your communities, and think about how I can bring some of that back to the work that we're doing. I want to start with a quote that really impacted me when I first read it a number of years ago. And that is the author, Jonathan Kozell, in his book, Savage Inequalities, writes about children with oral health pain. And he says, children will live with pain that adults would have find unendurable. And to me, that's tragic. This is a preventable disease. We need to think about it as being a disease. And, the fact that children and even adults are suffering with a preventable disease, is really tragic with the systems that we have in place. I'm going to I don't have that many slides, but I'm going to just bring up a couple that I can, speak to some of the what I'm going to talk about today. The first is that poor oral health affects the physical, mental, social, and economic well-being of individuals and entire populations. It affects the health of the body and also our ability to do basic things like speak, eat, and demonstrate emotions. The pain of dental disease distracts children in school and adults at work. The appearance of teeth also influences how individuals feel about themselves and how society perceives them. It's tragic, but that's the case, and we all know that. Poor teeth keep children from smiling, and we know it reduces job opportunities for adults. The cost of dental disease is often prohibitive for families, even those with health insurance, and it's also cost prohibitive for state government because delayed care means additional trips to emergency rooms and payment for emergency room care as well. And, I think this is where the Schuyler Center and many of the organizations here want to come into this issue, is that poor oral health is increasingly a symbol of social inequality. The data will tell us people of color, tribal communities, low income, uninsured, immigrant, disability, and rural communities all have significantly less access to dental care, and we know more oral health problems. And, I've been working at this level, at the state level for a long time, talking to policymakers about poor oral health. And it's often very difficult to talk about because it's unlikely that most New Yorkers will ever experience truly poor oral health or struggle to find dental care, because the disease is concentrated in people who also experience conditions that cause poverty and health disparities. So it's a concentrated disease in certain populations. You all know that with the groups that you work with. And because of the stark inequality in oral health status means that improving oral health for underserved populations is necessary for us to really advance the needle on health inequality overall. Let's see if I can advance slides here. So just a little background, it's a disease, it's an infectious disease, and it's transmittable. It's caused by bacteria that get in the child's mouth from a parent, from a caregiver. You're not born with that bacteria in your mouth, so it's transmissible. It's the most, many of you have probably already heard this data, it's the most common chronic disease of childhood, more common than asthma. But 80% of the disease is concentrated in 20% of children. So we're really talking about a concentrated population. Most children by the age of 8 have had a cavity in their primary teeth, and children from low-income families are twice as likely. And we have a little more data on that. Again, I told you I'm not a health professional, but a health professional shared this with me. You often hear people talk about caries, and I think we can just call them cavities. That's, there's other issues around them, but, most of what we're talking about is cavities, and especially in small children. And it's because that bacteria interacts with carbohydrates over time in the mouth, because of lack of brushing, poor oral hygiene, causes those carious lesions on the teeth and become cavities. So you can see from this data, and this is New York data, this is the National Survey of Children's Health, that the disease is really concentrated in lower income populations. Unfortunately, they don't break that out in other ways, but you can just see that, at least in the economic side, it shows up. And I think it's important to mention that Medicaid, CHIP, and commercial coverage are all required to do preventive dental care for children. But you can see in New York, children are not getting these preventive dental visits. And those visits could be done by either a dental provider or a pediatrician. Pediatricians can do and should be doing, it's a standard of care, early pediatric risk assessment, evaluations, education for parents, and the application of topical fluoride varnish. And if you're not familiar with that, if your own kids haven't had it yet, it's a substance that they paint on the teeth to help prevent them from cavities. And ideally, children should have it 3 to 4 times a year, depending on the risk that the child has for oral disease. And so there's a lot of reasons that this isn't happening. A lot of dentists don't see very young children. A lot of dentists don't want to see very young children, and that's understandable. They haven't been taught how to treat young children. A lot of pediatricians, it's hard to add a new service into a pediatric office, right? So there's a lot of education that needs to happen, a lot of technical assistance for providers to bring the service into their practice. A lot of parents don't know that their children should be getting oral health services at a young age while they still have primary care, so the parents don't always know to ask for it. So there's a lot of reasons this isn't happening, and some things that we have to be addressing at the state level as well, some policy and education pieces here. One of the things that we're trying to work on, even at the national level, is trying to dispel the idea that poor oral health is a personal failing. It's really a systemic failing. One of the ways that some national work has been doing to try to think about how do we reframe this idea of people having poor oral health is this idea of locked doors, that people need a series of things in order to have good oral health, like fluoridated water, which we know community water fluoridation is the most cost-effective, and it's a passive prevention tool. Nutritious food, if people don't have access to fruits and vegetables and they're eating high carbohydrate diets, that's not good for oral health. A lot of soda access, but a lot of people, as you know, in your own communities don't always have access to that. Dental insurance, we still have children who are uninsured for dental, even though they have commercial health insurance coverage. And we have a lot of adults that are uninsured for dental. And also finding a dentist that accepts insurance. So these are kind of doors that people have to go through in order to have good oral health. And so many of us have keys to those doors, right? We have health insurance. We live in communities that have dental access, that have dental care. And we also have, we may live either in areas with fluoridated water, or we use fluoridated toothpaste. And we also have access to, and we eat better food. So we have a timer here. If I don't move, or a motion switch here. Sorry. Yeah, my lights come back on. So some of the families that we work with don't have access, no matter how hard they try or how much they want it, good oral health. They just can't, they just don't have those keys. They're not in their possession. And I think people don't want poor oral health, and they certainly don't want it for their children. What they're missing is how to have the keys to get to the better services. So what's happening? So I'll run past a couple of things here. Last fall, the Schuyler Center and the Early Childhood Advisory Council at the state level produced an Early Childhood Oral Health Summit. It was here in Albany. We had about 140 people attend, which was amazing. A lot of early childhood providers, Head Start, community health centers, dentists, dental hygienists, pediatricians. We had a lot of activity, and a lot of state agencies were supportive, and the professional organizations and other health organizations were supportive and came and presented at this early childhood summit. Some of the activities at the summit were roundtable discussions about what we could be doing. And so we gathered all that information in from all those 140 people and processed it. A few weeks later, we held a policy summit where we invited the same people back to sort of sift through all the information they had provided us and help us digest that and break it out into actual real recommendations. So what I'm going to show you are the recommendations from the summit. And if I, in a minute, I will drop links to this in the chat because I can't get to them right now, but there is a summit report on the Schuyler Center's website that just came out with all these recommendations in it. So I'll drop the link to that in our website, and I've got some links to that in a minute. So these recommendations were just approved by the Early Childhood Advisory Council of the state. They approved these recommendations, so we are now moving forward with implementation. So for the rest of the year, there's going to be a lot of implementation activities that I can invite you to if there's any of these that have any interest to you. So first of all, we have sort of two big buckets. The first one is that the state should provide more technical assistance and programs to help communities and providers that are working with young children to improve early childhood oral health. And that means training and education programs. It means better access to materials. So parents are getting information on the importance of oral health, and providers are getting the same information as well. And also making sure that all this information is translated for families, so that we can make sure that anybody working with families whose first language isn't English can still access the same materials. The second big bucket is the policy bucket, right? Implementing strategies to increase access to oral health services for children ages birth through 5. So what we're looking at is really increasing funding for school-based programs, mobile dental units. I know those are a hot item right now. Teledental services, which sometimes people think, how can you do dental services through telehealth? But a lot of education activities can happen, and a lot of conversations with families about the importance of oral health, questions, sort of setting people up for a good dental visit can happen through telehealth. And I know some of you are working with providers and FQHCs in parts of the state. They're really using teledental services. There was a request that we reimburse more community health workers and these new sort of dental health coordinators, which are sort of community health workers on the dental side, to provide oral health education and care coordination. Care coordination is a very important area, and it came up a lot at the summit, is sort of helping a family that's been referred to dental services then get those dental services. And we know that community health workers do that very well. Medical dental integration. And if you've done any work in oral health lately, you know that that is the big thing right now. Oral health is often separate from overall health, but we know that that's not how it should be. So this idea of medical dental integration is really important. Are your primary care providers talking about oral health and making it easier to do referrals and making connections to oral health services? And some of the things we're trying to do is help provide financial incentives for preventive care, like reimbursement for risk assessment and care coordination that would help with that integration piece. But then also to use dentists to do some more primary care screening. They can do this in some other states, help screening for diabetes. I know in a couple of states they're actually helping dentists that work in FQHC do the Edinburgh screening for maternal mental health. If you have a pregnant woman that you see in your clinic to get their dental services, but you notice they haven't had that done because you're part of a FQHC, you can do that. It's not reimbursed right now. They only reimburse dentists for smoking cessation services, but we're looking to see if there's other things that they could be doing as well to help with that integration piece. Ensure that all families have dental insurance and understand how to use the benefits. And we know this is a chronic problem with Medicaid and health insurance generally, is that people don't always understand the benefits they have. So we need to make sure that they understand the dental benefits for themselves and their children, and they know how to use those dental benefits. And then care coordination, and part of that is transportation to dental appointments, especially in the rural areas where it's so far to get to a dentist that will take Medicaid. So we do have some short-term action items that we're actually starting to work on over the summer. One is there was expanding the number of people who can provide the fluoride varnish applications. Right now, it's very limited who can do it. A dentist, physician, nurse practitioner, and a physician assistant can do it. But an LPN, a medical assistant, a registered dental assistant can't do it. And they're all for a variety of scope of practice reasons. And we also want to allow parents to provide it under instruction. So one of the ideas is with a telehealth visit, what you do is you might bring someone into your FQHC, do the health visit for the child, put fluoride varnish on the child, show the parent how it's done. It's very quick. It takes only 2 minutes to do. And then in 3 months, you would set up a telehealth visit. Once that's set up, you would mail the kit. It comes in a kit to the family. And then on the telehealth visit, do it again with the parent. It's right now, it's not allowed in the state, and it has to do with provider regulations about handing the medication to someone else to administer. But we are having some conversations about this. We were thrilled this year that Assembly Majority Leader Crystal Peoples-Stokes from Buffalo did put in a fluoride varnish provider bill, and we were thrilled. It allowed for LPNs and registered dental assistants to do it. The parent piece dropped out, but we were thrilled that she understood the issue and put the bill in, and it did advance out of the Higher Ed Committee in the Assembly. The Senate side, we do have a sponsor, but they were unable to get the bill in by the deadline that had to happen. But we do have a bill sponsor in the Senate, and they're also very excited about this. So we're going to come back over the summer and have a conversation about, can we expand this and then try to get something passed next year. But it was great to have the support of the contingents from Buffalo to do this. Implement Medicaid reimbursement for risk assessment to expand the number of preventive services that are being reimbursed. So that's a conversation with Medicaid. Some of you have been involved in some of these issues in the children's health issue, know that we've been trying to get the state, advocates have been trying to get the state to submit a Medicaid waiver that would allow children who are on Medicaid or Child Health Plus to stay continuously enrolled in those programs until they reach age 6. So every year they don't fall off and have to be re-enrolled in the program. Medicaid is interested in this. They have stated publicly that they are interested in doing this. That means that once a provider sees that child for services, they don't have to worry about whether or not they're enrolled until they reach age 6, that they're going to have continuous access to those dental services. The New York State Department of Health has very limited capacity to do oral health services right now in terms of technical assistance. So we are going to talk to the state about increasing funding for the health department to provide technical assistance that we've talked about, and creating an online library of oral health materials for people specifically working with young children and pregnant women. I'm thrilled to announce that we are moving forward with that. We have a group of dental students that are going to take this project on and work with the state over the summer to put together a library that will be housed at the Early Childhood Advisory Council. So there'll be a place where Head Start and daycare and other people working with early childhood can go and say, I know these materials are vetted. I know these materials are appropriate to use and other people are using those materials. So we're going to be moving forward with that this year. And we're also want to work with the state to make sure that anybody working with young children have oral health as part of their training plan. So whether you work in child welfare or you work in childcare, or you work in home visiting, that there is an oral health component in all that work, so that we're constantly reinforcing with providers and with parents the importance of early childhood oral health. So that's one of the things that we're working at there. So with that, I'm going to stop the sharing. And oh, you good. You put the report up. The other piece, I wish that would stop doing that. The other piece that I would like to mention is there's another report we did that's specifically on the fluoride varnish, which we've shared with a lot of legislators this year, which explains why it's important to do the fluoride varnish applications, who can do it in New York, who can do it in other states, and why we should be expanding who can do fluoride varnish applications. So that is also part of that. And in a minute, I'll share a slide that has some links on it that Rachel can send out for just a variety of resources on early childhood oral health. So with that, that's sort of my formal presentation, but I really want to have a conversation now. Just so I forgot to mention the top, I'm actually a Western New Yorker. Originally, I've lived here for 30 years, but I'm from Cattaraugus County. And so understand a lot of the communities where you're working, Allegheny County, Chautauqua County, Erie County, how many times I went to Buffalo in my life. So I have a particular interest in not only oral health, but in assisting Western New Yorkers, as Rachel knows, because I know the communities where you're working. So Rachel, I don't know how you want to facilitate a conversation, but I would love to take this back.
Yeah, absolutely. Bridget, thank you. That was such a wonderful presentation and overview, and you captured so much. So thank you. I have a bunch of questions that I'm happy to introduce, but I certainly open it either in the chat or if folks want to. This is our summer learning session. So this is intended to be casual. This is intended to be participatory. So invite your questions. I see Bridget Hurley at the Children's Agenda has raised her hand. So Bridget, I'll invite you to come off mute and share.
Great. I actually have two questions. One is even though I know you're not a provider, Bridget, but we've talked about the fluoride varnish
Yep.
before. Am I saying that right?
Yep.
Yeah. Okay. And I didn't realize that it was, so it has to be applied multiple times each year for the duration of the child's childhood, or
now in their primary teeth. So
okay.
Usually what happens, and you can do it on older teeth, but the focus in Medicaid and in the Bright Futures is fluoride varnish on the primary teeth, and depending on the risk of the child for dental disease, it could be 2 times a year or it could be 4 times a year. High risk Medicaid children can be billed 4 times a year for fluoride varnish application.
Okay.
Once you get to the secondary teeth, then they start working on dental sealants, which are the
I see.
painted on plastic coverings that they put on secondary teeth. They can do fluoride varnish for other reasons, and you can do fluoride varnish in Medicaid up to age 21 if there's high risk, or for persons with disabilities that may have problems doing dental hygiene. There's some flexibility for applying fluoride varnish.
Okay, that's really helpful. Thanks. And then a broader question around, I'm curious about a lot different early intervention or early childhood providers, but
early intervention, Bridget.
Yeah, I know it came out right. Anyways, so but do they have it? Are they provided any resources in this? So when they're in the home working with families, the early intervention providers, I mean,
They
just
don't, but
curious.
Bridget, that's one of the things I want to talk, that we need to be talking about is anybody going into the home, are they talking about these services?
Yeah.
The inability to speak properly if you have poor oral health and you're a young child and you're just learning to speak is really critical. And they can't articulate that they have a problem because they don't know and they don't have the vocabulary to talk about it. So behavioral problems in very young children, if you're not, I know oral health isn't the only health condition that, but young children acting out and people not being aware of dental pain because it's hidden. It's called the silent epidemic, and it's hidden. I always say to people, if a child was walking around with an abscess on their arm, the first thing we do would get it fixed. But if it's an abscess in their mouth, we don't see it and we don't ask about it. And we don't understand always how to ask the child, are their teeth hurting? So unless we educate providers on, are you thinking about that? Are you asking that question? Are you talking to the parent about, is the child having a problem eating? That might be an indication that there's a dental problem that needs to be resolved before we can move to something else. Because the child just can't articulate it.
Thank you.
Great questions. Thank you. Other comments, experiences, questions for Bridget Walsh? I know that in one of a more recent meeting of the Allegheny County Early Childhood Development Coalition, this was a hot topic of conversation, and the question around water fluoridation, given the reliance on well water, was something that was brought up. And certainly making the news over the last several months was the water fluoridation issue in the city of Buffalo. So Bridget Walsh, curious if you have any comments about that, and then I'll take the next question in the chat. Thank you, Mark, for that. But any about water fluoridation and particularly the issues that are facing our rural communities given the reliance of well water?
Yeah, the Schuyler Center has been a big proponent of community water fluoridation. We've been a part of this fight and on the anti-fluoridation list for a while now. We worked a number of years ago now to get Medicaid funding to pay for fluoridation equipment in New York. We're the only state that pays for fluoridation equipment because we can show with our data that children in fluoridated communities cost Medicaid less money than children in non-fluoridated communities. The data shows that. And so we were able to convince Medicaid to set aside some funding. And so if a community wants to start fluoridation or needs to replace their fluoridation equipment, they can get a grant from the state to do that. We're the only state that does that. And we've also been very supportive of fluoridation activities, and when the issue in Buffalo arose earlier this year, when they found out that fluoride hadn't been added to the city of Buffalo, I've been part of the conversations with the health department and folks in Buffalo working that out. And it seems like there's going to be fluoride back in Buffalo as soon as they can get it back in Buffalo. We're relieved that the city doesn't want to remove it, which is great. And we understand that the issues are in smaller communities. So a couple of things. One is that grant program is available not only to put in fluoridation equipment, but to study the feasibility of fluoridation equipment in a water system. So if a water system is not sure what they can do, they can get a grant for an engineering study from the state that they don't have to pay for in order to see if they can do fluoride and what it would take to do fluoridation in their community. Also, the CDC has just approved new fluoridation system for small water districts. So one of the things that is really hindered smaller communities from getting fluoride is that the cost and the type of equipment that they need to put in was prohibitive. So this company invented this great new system. It's basically the chlorine tablets that you have for your pool in a fluoridation system for small water systems. And it doesn't take much to install it, and it's a lot cheaper. And these tablets are safe for the people working in the systems. I mean, air, dust and air has been one of the complaints, you know, from water systems. But these tablets are just like you use for your pool. And so that is just coming online, and we're really hopeful that the water systems in New York will be educated on this new system. And we can start getting some of these smaller systems asking about, you know, what would it take to do this in our community? How much would it cost, and what does it take to install one of these systems, especially as a water system is rebuilding like they are in Buffalo, and you know, there's all this federal money and state money coming to rebuild water systems, right? It's part of the infrastructure funding. If we can get on top of that and say, while you're rebuilding the water system, while you're upgrading your equipment, put fluoridation in, and then you don't have to come back and do it later. So I know I've learned more about the politics of water the last few years than I ever wanted to know. It's one of the most political things that you can do is water. But talking about the public health benefits of fluoridation, when you're talking about the public health benefits of clean water, is a real marriage. And some of the other states are really starting to make that connection and saying clean, healthy water also includes fluoride. Fluoride is in all water. It's naturally occurring in water. All community water fluoridation does is adjust the level to make it beneficial for teeth. Some water systems already have that, you know, because it's natural. You know, it comes out of rocks, it's natural, and every place has a different concentration of fluoride. That's all we're doing with that, is adjusting the level that's already there to make it a prevention for cavities and teeth, strengthen teeth.
Thanks, Bridget. The next question came from Mark Anthony Bucci, talking about just the kind of the folks around the table around the early childhood oral health. You had mentioned the summit, which the recommendations came out of and that we are uplifting today. Can you talk about some of the stakeholders and both statewide agencies and then community partners that kind of ran the gamut of who was in the room and kind of who's at the table that we can learn from? It's okay. It's summertime. It's like it's a party, right? We're having a.
So Medicaid is at the table. I have to say, Medicaid. Few years ago now, 5 or 6 years ago, Medicaid actually hired a Medicaid dental director. There actually is a Medicaid policy shop now. They have, I think they're up to 3 or 4 people in the Medicaid policy shop right now, which is great. We're one of the few states that actually have 2 dental directors, one in the Division of Family Health and one in Medicaid. And so they really have been at the table. They did a learning collaborative, a national learning collaborative last year, working with pediatric offices on the implementation of fluoride varnish in pediatric offices. And they were working with some managed care companies to have the managed care companies help work with their pediatricians on implementing fluoride varnish. So they've been really helpful. They are on the work group that helped set up the summit and is now working on implementation. We've started having conversations about what would it take to expand some of these billing codes and allow for other providers. So we're at an advantage in the state that we do have a Medicaid dental director. Schuyler Center takes claim to that, by the way. We've been harassing Medicaid for so long that they didn't have real strong oral health policies. And the dentist, Michelle Griggetts, is great. She is a dentist that specializes in special needs populations. And so it's, you know, she's been doing a lot of work. You know, Medicaid this year increased the rates for dentists working with special needs populations. And, you know, so they're making some progress on that, but they're very receptive, open, great at technical assistance. So they've been really, really good partners. And OCFS has been at the table. They're part of the conversations. They're on the advisory group. They're part of the ECAC. They oversee childcare regulations. In New York City has separate childcare regulations. In New York City, they're required to do toothbrushing at daycare centers. It's part of their standard of care. Upstate, it's not. The OCFS regulations, it's not. But they're very encouraging and supportive and open to technical assistance, open to working with providers. It's the mandate piece that gets in the way, but New York City does mandate it for their daycare centers. There's been a lot of conversations with Head Start and the Head Start health directors on how we can expand services within Head Start and education programs for families and parents. There's some work going on, if anybody's interested, actually out of Buffalo, with the Head Start folks in Buffalo. They're working with the New York State Dental Society and Head Start on these, what they're called community dental health coordinators, which often are like a dental hygienist that then takes a certification program to become like a community health worker. So they have the understanding of oral health, and they can do all the case management, family facilitation services of a community health worker. And some of the FQHCs are using them and just absolutely love them because they can do telehealth visits with Head Start families and do the oral health education. And they work very well with migrant and immigrant communities that may not have a strong history in oral health. If you come from places where you can't drink the water, toothbrushing isn't necessarily one of the things that that they have been educated on. And so a community dental health coordinator having the health background and coming from the community and having those skills have been very effective at getting some families understanding and connected to dental services in a way that someone that doesn't have that oral health background has. It took me a long time to be convinced that they're effective, but the FQHCs that use them absolutely love them. So I'm now convinced. And so they're working on a project with Head Start and working with some community dental health coordinators to show the effectiveness of care coordination and management using these folks. So and home visitors, families with well water in terms of fluoride. I'm not a practitioner, so I'm not going to talk to you about what the recommendations should be, but I can help you find the right resources from the American Academy of Pediatrics and from the American Academy of Dental Public Health about what you should be talking to families about. I'm sure there are flyers and materials out there for families with well water. Working with pediatricians to understand when a family has well water and to prescribe fluoride supplements is really important, which is why we need to understand when. So it's why it's important in Buffalo to understand when the water wasn't fluoridated, because pediatricians didn't know to provide fluoride supplements. But in those areas where you have a lot of well water, maybe we can work on a campaign to make sure all pediatricians know to be asking and then providing fluoride supplements to families if that's it should be the right thing to do in that situation.
I'm sorry, Bridget, I was just going to give you a moment to breathe. Carrie, just building off of that question, was there anything that you wanted to add or any additions to what Bridget had mentioned? And then I'll uplift Danielle and Help Me Grow's question.
I can't think of anything. Is there just, I can look it up myself, but are you aware of anything on the CDC that might have information to give to families on oral health?
There's CDC has a lot of fluoridation resources. There's also a resource that's called My Water's Fluoride, and it's a CDC website, and you can put in your address and it will tell you if the water's fluoridated. So the states put information into the My Water's Fluoride, and then people can ask. So pediatricians can look up fluoridation. I think it goes, water is strange, right? It doesn't go by, because think about your own water system, right? It's not by zip code, it's not by town line, it's not by, water systems cross towns and dividing lines. So it can be difficult to know. And parents don't always know where the water came from. So My Water's Fluoride can help with that a little bit, because it can help figure out maybe which water system the family's getting water from if they're unsure. So that's often a resource that pediatricians and parents can use to identify areas. I will say upstate, it's very spotty once you get out of the big cities. Only 50% of New York outside of New York City is fluoridated. So we look good at a national average, we're over 70%, but that's because all of New York City is fluoridated. So if you take out New York City, we're less than 50% for the rest of the state.
That's unbelievable. Bridget, you are such a wealth of knowledge.
You've been doing this a long time.
I know, but that's why we invited you, because you know your stuff and you are such a tremendous resource on this issue. The one thing, so I wanted to just build on Danielle Galinsky, the Assistant Director of Help Me Grow Western New York, her question, and I know you mentioned you did have an additional slide of like toolkits, resources, ways to be able to share this with our families and those that we work with. I would just ask if there are a couple of resources that you wanted to spotlight that give you the chance to share that and your recommendations of how we should be communicating this sort of messaging. And then I will also just amplify that there is an opportunity to uplift our voices as advocates for young children throughout Western New York and New York State, that there is that legislation that has been introduced and some opportunities to take action on that as we look in the year ahead. So, and particularly around the parental application of varnish, I think is something that is, critically important. As a mom of a 2 and a 5-year-old, as my daughter Vivian likes to call it, it's the sparkles we put on our teeth. So with that, do you want to share a few resources or kind of the best ways to communicate with our partners and communities around early childhood oral health?
One of the couple of things that come to mind. One is I'll throw out there, a number of years ago, the Schuyler Center was part of a project to see if we could help create conditions in communities to reduce early childhood oral health using preventive measures. So what happened was the health department worked, actually it was the Health Foundation of Western and Central New York did a project on what preventive services reduce oral health and disease in children. The health department took that data or provided the data for that. They asked us to turn that into a community project. So we actually have what's called a campaign kit to reduce early childhood oral health. We worked on this in the North Country, which still has a project called Keep the North Country Smiling, which is the counties across the top of New York, led out of the Jefferson County Health Department. They have come together to say, what can we be implementing across our areas? How do we collectively work with all the pediatricians to make sure they're doing this? Support community water fluoridation. I think there's 6 initiatives that are part of that toolkit. So we have a tool that anybody can use to sort of say, how do we get our communities together and think about what is the 1 or 2 things we want to do collectively? And then what I can help people do is connect to resources around the country. So if you wanted to start some sort of a campaign or have materials or work with pediatricians, it's going on all over the country, and I can help you sort of find the best resource that fits with you. If you want to make sure all your daycare centers were using the same curriculum for toothbrushing, there are evidence-based oral health curriculums for school-based programs or in early childhood programs. All that stuff exists. We just need to let people know it's available. And so this community campaign kit can sort of help you think through that, who you bring to the table, how you think about your own resources collectively in a community. and how as a community you'd want to take a step at a time to introduce these services. So I can make that available to Rachel. We have a campaign kit, and we also have a moderator's guide, so we can walk you through all the steps to do that. And I'm here as a technical resource as well. Cortland, the city of Cortland did it. Madison County has used it. The city of Albany, and actually the city of Buffalo a number of years ago, but we found that it didn't work so well on a city level. It kind of works better on a larger basis. But I'm happy to help anybody work through any of that. So that's one thing. The last slide I'll give you has connections to the HRSA Maternal and Child Health Oral Health Center. They have a ton of information. If anything you want, any kind of handouts, workbooks, coloring books, any of those kinds of things, HRSA has all that stuff. And so I'll make that available at the end as well. So you can, go through those resources and see if there's anything. But that's the idea of putting a library together. So if you have those questions, that it's on the Early Childhood Advisory Council's website, and it's already been vetted. The state's looked at it. We've looked at those resources. We've looked at those websites. So you don't have to think about, is this the right thing for me to be using? You'll know it'll be on that website. We're hoping to have something operational by the end of this year for that.
Thanks, Bridget. So I am looking at the time. So
can I just want to bring up, if I can, real quick, the last two.
Oh yeah, for sure.
I don't know how to do this. Did I hit? All right, share my screen. I just want to show these resources real quick. So the first thing is, if you want to participate in anything, we have a couple of things coming up. Where I can find it. The summit had a policy work group. We have our first meeting next week. If anybody's interested in any of the things I talked about and you want to jump in on the policy recommendations and implementation, send me an email at this email address and I'll add you to that list. We'll have our first meeting next week, and then we'll talk about what we're going to be doing for this implementation, including the fluoride varnish bill, at this meeting next week. One of the other things I'm going to be adding to that, by the way, is other states have eliminated the sales tax on dental hygiene products. And so that's something to add to our list of things to think about. And then there is going to be another early childhood another summit in October. And those are the dates. And if you want to be added to a list to get information on that summit coming up in October, send me an email and I'll get you on that list. And then I'll send Rachel these slides and you can, that has the resources. So that's it, Rachel.
That's great. Thank you, Bridget. And nice to see that the dates have been set for the next Oral Health Summit. So thank you for that. We will definitely be sharing the slides and the recording. We know that there was a lot of interest, but this also apparently was a really busy day for folks, which is good because everyone's doing the good work for young kids across our region and across the state. So I'll just say to Bridget Walsh, we are just grateful for your leadership and all of your wisdom that you shared today. Thank you so much for joining us as part of this Liftoff Lunch and Learn. And we know that there's going to be more work to do. And as Bridget and I've shared, that Liftoff is here as a resource and a partner and helping to convene folks and bring folks to the table around early childhood oral health and making sure every young kid in our communities has a reason to smile. So just again, thank you. And just one quick announcement. We do have 2 more Lunch and Learn sessions as part of our summer learning series coming up. So in July, we have in mid-July, and we'll put a link to register if you haven't done that already. We're going to be showcasing and sharing the data dashboard of Help Me Grow. Western New York, which Liftoff is a leadership partner, and Emily Oakes is going to be our featured presenter. And we're going to do a little bit of a data walk and actually talk about what the data is telling us about young children's social, emotional, and healthy development. And so that's going to be a really incredible program. And then in August, we have, which we haven't promoted, so this is the spoiler alert, you're the first to hear it. We're putting together the promotional right now, but we have Jeff Smink, who's the Assistant Director of Education Trust New York. He's going to feature their latest report and recommendations on early literacy and the state of early literacy in New York State, and then those policy and practice recommendations to make sure our youngest learners are being set up for success. So that will be our August session. Again, lunch and learn. This is meant to be casual. Enjoy your lunch, have a snack, another cup of coffee, and then we'll be announcing what's happening for the fall. So again, Bridget, Walsh, thank you. And thank you to all of you for joining us today. It was great to have you. Thank you for your thoughtful comments and questions. And we'll look forward to seeing you at the next one. I hope you all have a wonderful day. So thank you so much, and we'll see you soon.